Many women in their 40s are pulled between caring for their kids and parents all at the same time.
Of course, you wouldn't know that yet. You
Not
young
yet.
men over there. But caring for our own health, especially when we have families to care for, is really hard. It goes on the back burner a lot and just doesn't happen. Our TV6 reporter Stacia Matthews has some eye-opening information about women should be checking after they hit the big 4-0.
I've been covering health stories for more than a decade, but what I learned while putting together this story really surprised me. I had no idea that I should have been getting one particular checkup for a few years, and that it could be so revealing. 40-year-old Missy Ayala is making a trip home during lunch to surprise her unsuspecting children. Inside, 20-month-old triplets, Nia, Isa, and Max.
It's pretty crazy, and I work full-time as well, so, but I wouldn't trade it for the world.
What you doing, Peanut?
Life at this point is very scheduled. It is all about a schedule when you have triplets.
That includes a routine annual checkup for herself.
Because I want to be around to see these guys grow up.
So, seeing an eye doctor now could help make that happen. Missy was surprised to learn a vision test is part of a growing list of recommended screenings for women at 40 years old.
The eye is the window to the soul.
Optometrist Dr. Jeremy Ciano says it's also a window to the rest of the body.
From a medical perspective, there's a lot of things that we check out, such as diabetes, hypertension, and especially for women, multiple sclerosis.
MS typically strikes between the ages of 20 and 40. The first symptoms a patient notices include numbness, tingling, and loss of balance. But Dr. Ciano says an eye exam can detect trouble even before these symptoms appear.
The good news is we've found it. The bad news is we've found it. But that's our responsibility as optometrists, is to make sure that people are healthy as well as seeing well.
They're gonna go back to work.
Missy never considered the eye exam, especially since LASIK surgery corrected her vision 8 years ago.
It's not like an annual mammogram. There's no communication out there that by the age you turn 35, you need to have a mammogram. So I guess really with the eyes, you just don't hear that.
Doctors say Missy should also add a diabetes and vitamin D test to the list.
You're all right.
For Missy, tearing herself away from a busy family is hard enough. Making time for the doctor is especially hard with triplets, but she wants to make sure she's always around to come home.
I will schedule an appointment. Absolutely. It's important. It's very important.
The eye exam can also spot vision problems you may not realize you have, including depth perception and color blindness. Stacia Matthews, RTV6.
So here's the full list of checkups the doctor told us that you should have in your 40s, along with a full gynecological exam. Check your skin, blood pressure, cholesterol, and vision. Also test for diabetes and your vitamin D levels. Tomorrow, Stacia tackles what women should do in their 50s. If you're not ready for that one yet, make the list anyway for your mom, an aunt, or a good friend.